Alexis. I'll be your nurse today. I'm gonna wash my hands
Thank you.
and I'm going to pull the curtain for privacy. Could you tell me your name and date of birth?
Henry Haley, 12/9/69.
Can I see your wristband?
Yes.
Great, that matches. So I'm going to perform a head-to-toe examination on you today. And by looking at you, it looks like you have no signs of distress. Your color is appropriate for ethnicity. Your breathing is normal. You're dressed for the weather, and your grooming, hygiene, and nutritional status seem to be adequate. So I'm gonna ask you a few questions. Do you know where you're at right now?
Yes, I'm at Chelsea Hospital.
Do you know what time it is?
9:47.
And do you know why you're here today?
Head to toe examination.
Awesome. So you seem to be alert and oriented. So it looks like someone came to take your vital signs. They tested your temperature, respiration rate, heart rate, and oxygen saturation, and those all seem to be within normal limits. What would you rate your pain 0 to 10? 0 being no pain and 10 being the most.
0. I feel pretty good.
Awesome. So I'm going to start out by palpating your head, and it looks like the size and shape seem to be normal. I don't feel any masses or bumps and lumps or anything. On your scalp, I don't see any lesions or rashes or lice or dandruff, which is all good. So looking at your face seems to be symmetrical. The color is appropriate for your ethnicity, and I don't see any lesions or rashes. So I'm going to test your cranial nerve 7. Could you smile for me? Could you frown? Could you puff out your cheeks? Awesome. So your cranial nerve 7 is intact. So I'm going to do an examination on your eyes. So it looks like your eyebrows, your eyelids, your lashes all look good, and your eyes are symmetrical. I don't see any signs of edema. Your corneas are clear and not cloudy, and your scaleras are white and look normal as well. So now I'm going to have you follow this pen light to see if your pupils react. And your pupils are equal, round, and reactive to the light. And I'm going to have you stare at this pen and just follow where it goes. So your eyes follow the light appropriately, which means your cranial nerve 3 is intact. So now I'm going to inspect your ears, and by visual inspection, I see that size, shape, and are all seen to be normal. I'm gonna look inside, and I'm gonna look inside on the other side. I don't see any foreign bodies or discharge, which is all good. I don't see any edema, so now we're gonna do the whisper test. So I'm gonna have you cover one ear, and I'm gonna whisper something in the other, and you say, repeat it.
Okay. The grass is green.
And same on the other side.
The sky is blue.
Awesome. So that means your cranial nerve 8 is intact. So now we're gonna move on to your nose. So I'm gonna have you tilt your head back for me. And it looks like your septum is midline. Your shape and size of your nose is normal. I don't see any discharge or edema. So now I'm going to do a patency test for you. So I'm going to have you close one of your nostrils and breathe in and out. And do the same thing on the other side. So patency and breathing seem to be within normal limits. So I'm going to have you open your mouth for me and say ah. Okay. So your mucous membranes are pink and moist. There's no discoloration or odors or lesions. There doesn't seem to be any missing teeth or decay. The uvula falls and rises, which means the cranial nerve 9 is intact. So now I'm going to palpate your lymph nodes, and please let me know if there's any tenderness or pain when I do this. And there's none? No pain or tenderness?
Nope. It's fine.
Good. And so I'm gonna see if your trachea is midline, which it is. And I'm going to palpate your carotid arteries. So your carotid pulses seem to be strong bilaterally. And now, if you would, could you lift up your shirt for me?
Yep.
Awesome. So I don't see any discoloration or hair discoloration on your chest. Distribution seems to be normal. Contour seems to be normal. And your chest seems to be symmetrical. I'm going to palpate to see if there's any muscle masses. And I don't feel any. And your temperature seems to be within normal limits on your chest. And no crepitus is present. So you can put your shirt back down if you'd like.
Mhm.
So now I'm going to inspect your lung sounds. And it doesn't look like you're having any retraction when you're breathing. But I'm going to osculate your chest. And I'm gonna do your posterior chest. I'm gonna have you sit up for me. And I'm just gonna have you take deep breaths in and out. Awesome. And I'm gonna do the same thing on the front. You can lean back if you'd like. Okay, and so your lungs sound to be cleared bilaterally. And so now I'm going to find your apical pulse
Okay.
by finding your apical landmarks.
Mhm.
So first I'm going to feel for the sternal notch, which is right here, and I'm going to go down to the angle of Lewis. I'm going to go over to the left a little bit to the second intercostal space, and I'm going to go mid-clavicular, and I'm going to go down to the third space, fourth space, and fifth space. And this is where your apical pulse is going to be. And I'm going to test that for 60 seconds. And I'm going to test your brachial pulse at the same time. And so your pulse needs to be strong and regular.
Thank you.
So now I'm going to do a visual inspection of your abdomen. So if you could lift up your shirt for me.
Mhm.
So your color and contour seem to be appropriate. I don't see any lesions or lashes. Your umbilicus seems normal. I don't see any pulsations or distensions. So first, I'm gonna listen to all 4 quadrants of your bowel sounds, of your bowels. And I'm gonna start on the lower right. And bowel sounds are present in all 4 quadrants. Now I am going to palpate your abdomen. If you have any pain or tenderness, please let me know. Okay. So no tenderness is noted, which is good.
Mhm.
So now I'm going to feel your arms and legs to check for discoloration or muscle masses. And I don't see anything wrong. I don't see any lesions or signs of edema. And I don't see any muscle masses. So now I'm gonna have you do a strength test. So I'm gonna have you push against my hands. Ready? Squeeze my fingers. And I'm gonna have you push your feet against my hands. Okay. So your hand and heel strength seems to be strong bilaterally. So to test your cranial nerve 11, I'm going to push against your shoulders, and I don't want you to let them fall. Okay. And I'm going to have you turn your head and push against my hand. And do the same thing. Okay. So cranial nerve 11 is intact. So now I'm going to have you stand up for me. And I'm going to have you put your feet together. Put your arms out to the side. And close your eyes. Great. So the Romberg test was negative. And I'm going to have you now take 3 steps forward. And 3 steps back. And the gait test seems to be normal. So you can take a seat. So now, one of the final things we're going to do is I'm going to check your radial pulse for 30 seconds. Okay. And now I'm going to take off your socks. Your socks. And I am going to test your posterior tibial for 30 seconds each. And then I'm going to do your dorsalis pulse for 30 seconds. And all your pulses seem to be bilateral. Lastly, I'm going to check your capillary refills. Can I see your fingers? Normal. And you'll see me normal. Okay, so I'm going to leave your stuff. And so your capillary refills are brisk, and this is great for you. But I'm all set now. Everything looks good. Is there anything else you need?
No, thank you. That was very thorough.
Great, Henry. I'll be back soon after I see a few more patients.
Thank you.